Could better bedside manner actually improve patients' health? Dr. James Merlino certainly thinks so. He's the Chief Experience Officer at the Cleveland Clinic. He joins us now from the clinic's Patient Experience Summit. Hi, Doctor. Thanks for being with us.
Hi, Sarah. How are you? Thank you very much for having me.
I am good. So part of the pitch you guys are trying to make there is to convince physicians it's not just on nurses, it's not just on aides, but it's up to the actual doctors to have a better bedside manner. Why is that sometimes kind of a tough sell?
It's a tough sell because you have busy clinicians who have been educated a certain way for, in some cases, decades. And really, it's about changing behavior. The focus on the patient experience is not about making patients happy. Ultimately, it's about how we think about delivering care. And that impacts not only satisfaction, but also safety and quality.
You say it impacts quality. So when you talk to these doctors about bedside manner, does it actually improve patients' outcomes to have kind of a better interaction with their physician?
Absolutely. So if you look at Medicare's survey that they use for inpatients, there are 9 questions about how we communicate. And those are basically considered patient experience questions. But when 3 of those questions are about how nurses communicate, 3 about how physicians communicate. When nurses communicate better at the bedside, medication errors go down, falls go down, and pressure ulcers go down, and those are safety issues. When physicians communicate at the bedside, coordination of care with nurses goes up, and compliance with treatment goes up with patients and their families, and those are quality issues. So this isn't about making patients happy. This is about using the bedside manner to drive better care delivery.
Now, obviously, your industry is facing other big changes this year, the implementation of the Affordable Care Act. I have to wonder, from your perch on the ground there, what impact are you guys seeing from more people gaining private coverage or gaining Medicaid coverage under the Affordable Care Act?
Well, I think one of the things that the ACA is doing is actually improving access, because it's giving patients the opportunity, when they haven't had insurance in the past, to actually get into systems to be able to have their care better managed. What you had in the past was a lot of patients that just didn't have regular opportunities to bump up against the healthcare system, and they would use things like the emergency department when things got out of hand. But now what you're seeing is more patients that are in systems so that we can do a better job of managing their health. At Cleveland Clinic, that is one of the strategies that we're employing, is how do we bring more patients into a population management strategy so that we can decrease disease and improve the health of our populations.
And have you seen that change at all? Are there fewer people that are hitting up the emergency room and more people kind of signing on to a more comprehensive care plan?
Absolutely. You're seeing that not only in Cleveland and not only at the Cleveland Clinic, but you're seeing it across the country as emergency department utilization is starting to drop. And that's what we want. We want patients being seen by the right provider at the right time in the right place, and that's the Cleveland Clinic strategy behind it.
All right, Doctor, thanks very much for joining us.
Sarah, thank you very much, and it's been a pleasure to be with you today.